It depends on what you mean by the first one. If you mean official, legally endorsed by policymakers, by as well the provincial authority from Paris, and yes, this is the first one. If you mean existing room spaces for people who inject drugs, no, it's not. You have a lot of informal, but as we say, as in many settings, informal places where you have people injecting drugs with harm reduction outreach worker, for example, in free parties. So this is temporary place. Or even in some drop-in centers. It's not official, but we know that in toilets, blah, 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 they can inject. So as it was illegal to organize this kind of service before, at least we are putting some, needle injection inside anyway. But, and we had as well 20 years ago a real, I will say, experience, but it was completely led by outsider people, mainly coming from this people using drugs organization, ASUM, the French one, and they were using their office to establish a consumption room. But unfortunately, a couple of days after, there was a young girl who made an overdose. So at this time, there was a mass media campaign against, with public opinion against, so it was very difficult to counteract. So those are the different experiences that, at an official level, once again, fully included in a harm reduction package of currently existing in France. Yes, it will be the first one. I really would like, and this is one of the input of my organization, MDM, is this project, that we maybe refresh the concept of consumption rooms and to be more in a kind of practical education. Means not only to supervise people injecting, for example, in a place, but to be more active, which is not the case in any existing consumption room right now in the different countries. And this is why we have been developing for 3 years now an experimental program whose name is Education to Risk Related to Injection, and we propose some kind of session. Actually, it's like a face-to-face session, and you have the guy who is coming with his material, his product, the usual product, and we propose him just to inject in front of us, telling nothing. And then, when it's finished, step by step, we try to analyze with him the way it was good or not so good practice. The phase in injection course, he was taking some risk, and especially regarding Hep C and not only HIV. And we propose him a set of sessions like this, 2, 3, 4, 5, and at the end we make a kind of evaluation. I would say it's like school or technical school. So that at the end, bad practices, especially to stop bloating after injection, all those things, they remove the bad practices to good practices. So this is the kind of service we are going to provide in this consumption room. So not only providing a safe place, I will say, but be in a more comprehensive approach and proposing this kind of education service. I will say it's like a professional training. If you need, you want to eat some good bread, and you go to the bakery, and you will prefer to have the bakery that has been trained on technical level to be able to produce a good bread. If the guy is a butcher, he will not be able, to make a good bread. So this is exactly the same with this concept of education related to injection, to increase, to improve the performance, I will say, of injecting people, even for long-term injecting people, because sometimes they know that they are convinced that they know just because they practice injection for 10 years, 20 years. But at the beginning they were practicing with quite not good way, and they keep this way for 20 years. So it's kind of break in those bad habits, I will say, to promote the global health status of those people. I'm convinced that if we not only provide this kind of safe hygienist place, which is at least the low level of service, but we go on quality and the technique of injection, quality and the product, and talk about self capacity of the injector to get the information you need, to have a higher level, both of pleasure, because it's also a question of pleasure, but also of safety for himself. And it's not only a question of overdose, I will say. Even the vein, capital, you know the story. Sometimes it's destroyed just because they didn't know the injection sites, or they destroy the sites. So there will be as well quite a practical approach to explain the difference between veins and arteria and all those things. So it will as well reduce not only blood-borne viruses, but as well all those risks associated to injection, including overdose and